Clínica TV. Clínica TV.
Hola, buenas tardes. Estamos aquí transmitiendo desde Clínica TV con muchísimo gusto de presentar al doctor Dave Stukus, y él es uno de nuestros invitados internacionales. Estamos muy entusiastas después de la plática que nos acaba de dar sobre alergia a alimentos, con especial enfoque a alergia a cacahuate y a nueces de árbol, pero ahorita tenemos el gusto de que nos platique un poquito sobre el panorama general de las alergias alimentarias, con enfoque a la población pediátrica, y aquí tengo el gusto de presentarlo. Él forma parte del Colegio Americano de Alergia, Asma e Inmunología. Entonces es un placer que esté aquí en la Ciudad de México con nosotros el día de hoy. Thank you very much.
Yes, thank you very much. And I'm honored to be here, and I'm happy to talk about food allergy. When it comes to food allergy, people need to have immediate onset and reproducible reactions whenever they eat a food. So if somebody's eating a food without having any problems, such as itchy hives or skin rash, swelling, difficulty breathing, difficulty swallowing, vomiting, or a severe progressive reaction called anaphylaxis, then it is extremely unlikely that they have a food allergy. So testing should not be done in those patients. However, if somebody does start to have issues with hives, swelling, difficulty breathing after eating a specific food, then they should be evaluated for potential food allergy. Typically, parents of children or adults are very good at identifying at least the meal or the snack that they were eating at the time of their symptoms. And you can hone in on trying to focus on that history of what were you eating, how soon after you ate it did you start to have symptoms, what symptoms occurred, how long did the symptoms last for, and was any medication necessary to help make the symptoms go away. For instance, many people develop hives for no good reason. And a lot of times, people will naturally link that back to something that they were eating. And the story may be, I was eating a meal or a snack, and I developed hives later that day, and the hives lasted for 5 to 7 days, then went away. Well, that's a very different diagnosis. That's a diagnosis such as acute or chronic urticaria or hives, which often has nothing to do with allergy. However, if they say, I was eating a meal containing a dairy product, and within a few minutes I developed hives on my face and body, and itching and some swelling of my lips, that story is much more consistent with having a food allergy. So we really want to use the clinical history to focus in on some specific detailed questions about what was the suspected food, what were the symptoms, what was the onset of action, and how long did they last for. Then based upon that, consider whether that patient should then have food allergy testing done. When it comes to food allergy testing, there are 3 ways that we can test for food allergy. The first way is in the office setting, often in an allergist's office, where we do something called a skin prick or scratch test. This involves taking a drop of the liquid allergen, placing it on the skin, usually on the back or on the forearm, and then gently scratching through the top layer of the skin to introduce that allergen to those allergy cells living in the skin called mast cells. If that person has an allergy antibody attached to those cells, within about 10 or 15 minutes, they will develop a localized redness, swelling, and itching that would indicate that they may be sensitized or allergic. The other way that we can evaluate for food allergy is by ordering a blood test, where we can measure one or several different food allergies at once, although it's often highly recommended to avoid large screening panels because that may lead to unnecessary elimination of foods that come back with results that may not be able to be interpreted. But you can measure specific levels in the blood towards food allergens, and you'll get a result back on a number scale that can help indicate whether that person is sensitized or allergic. Now, when it comes to skin prick or blood tests, the size of the test result can help determine the likelihood that that person is allergic. But the size of the test result by itself doesn't necessarily mean that they have allergy. So if you do testing on somebody who's eating a food without problems, we know that about 30% of people will actually have elevated levels to their food allergy tests. But only about 5% are actually truly allergic. So we want to start by using a good clinical history to determine who should have testing in the first place. Another common pitfall is that the size of the allergy test result, both by the skin prick or blood testing, do not determine the severity of the allergy. A larger size skin test or blood test merely indicates that it's more likely that that person is actually allergic. It doesn't necessarily mean that they could have a life-threatening or severe reaction. There are many patients out there that can have a severe allergic reaction and have very mild test results, And likewise, there can be people that have very large test results but only have mild symptoms when they eat the food. Now, the gold standard way to determine if somebody truly has a food allergy is something called the oral food challenge. For patients whose clinical history is not very determinate, or they have testing that isn't diagnostic for one reason or another, or for those people who have a known food allergy that may be outgrowing it or developing tolerance over time, the oral food challenge is a way to determine whether they're truly allergic. This should only be done in the office setting under physician supervision, and this often involves the allergist because they are best trained and well equipped to treat a reaction should it occur. And what this involves is you take a patient and you have them come in for a few hours, and you give them gradually increasing amounts of the food that you feel that they may be allergic to or no longer allergic to. You start very, very small, and you basically give them increasing amounts every 10 or 15 minutes. Once they've tolerated roughly 1 or 2 servings, or about 6 to 10 grams of the food protein, you then watch them for a couple of hours. If they don't develop any symptoms, then it's extremely unlikely that they are still or ever were allergic to that food, and they can incorporate it back into their diet. Now, the oral food challenges can be very safe when done in a proper manner, but the patients need to be selected appropriately based upon their clinical history and most recent test results. The oral food challenge is the gold standard way to diagnose food allergy and can make a huge difference in the lives of our patients. Once a food allergy is diagnosed, patients need to be educated regarding food allergen avoidance. This involves reading labels on packaged products, communicating their food allergy to teachers at school, cafeteria workers, food handlers at restaurants, bakeries if they're getting ice cream and such. And they want to make sure that they try to avoid eating their food knowingly. However, accidental ingestions can occur. Therefore, patients should be educated to recognize the signs and symptoms of an allergic reaction should one occur, and they should always have medication with them to immediately treat any reactions, especially a severe, rapid onset reaction called anaphylaxis, which can involve any combination of hives, itching, difficulty breathing, difficulty swallowing, vomiting, so on and so forth. Should that occur after accidental ingestion in somebody with a known food allergy, then they should be equipped to have adrenaline with them and be taught how to use this promptly to help reverse all of those symptoms of anaphylaxis and then seek emergency medical care. Should they not have medication with them, then they absolutely should be educated to seek emergency medical care should a severe allergic reaction occur, because prompt treatment can resolve all their symptoms and prevent a potentially life-threatening situation from occurring. Many patients with food allergy can learn very easily to avoid their known food allergens. They often become very good at finding recipes to prepare foods that have substitutes so they can avoid their allergen, and generally can do quite well in maintaining a very high quality of life as long as they receive the proper education and counseling in regards to their food allergies.
Semita TV.